Today I'll be showing you the hip medial glide and the hip lateral glide, both in combination with physiological motion. For the medial glide, it's simply putting the head of the femur laterally into the acetabulum. So this is indicated for restriction in hip abduction and external rotation. Patient's hip at 90 degrees. I'd have my hand wrapped around the medial aspect of the knee, and with this force I'm pressing the head of the femur into the acetabulum, and then with the physiological motion I would move them into abduction and external rotation. Causing the separation there allows a little bit more degree of freedom, as well as mobilizing the tissues around the joint capsule. The hip lateral glide. This is the complete opposite. It's going to have a little bit of distraction in the hip joint, and this is for indicated for restrictions in hip adduction and internal rotation. So again, I have them up to 90 degrees. I have my hand wrapped around the inside, the medial aspect of the knee, and then when I do this on a patient, I will have a mobilizing belt around the crease of the groin, and I'll be keeping the lateral aspect of the femur stabilized as I distract. So on this, I would be leaning back, causing the distraction, and then I would cause internal rotation and adduction into the hip. Now when I have a patient that I would demonstrate here shortly, they will be doing this as an active component while I apply the force and cause the distraction to loosen up the joint capsule. So the first one, like I said, is the medial glide, and this is indicated for restrictions in hip abduction and external rotation. So right here we're in a distracted phase, so the medial glide would actually be pushing the head of the femur into the acetabulum, and the two motions are abduction and external rotation. So we can see how approximation of the joint capsule can increase these two motions. The second one is, of course, the lateral glide, and that's where we would be having, right here is where the belt would wrap around, and then I would be stabilizing here, and we would be leaning back to cause that distraction. This is indicated for restrictions in hip adduction and internal rotation, which would be across here, and internal rotation. So we could see how bringing that out of the joint capsule would increase these two motions. This just mobilizes the tissues within inside the joint capsule and releases it up for the physiological motions. So we're going to go ahead and demonstrate the lateral and medial hip glide with the physiological motion. So to go ahead and instruct her, I'm going to take her up through the range of motion and let me know when this hurts. If you feel any restriction here, a little bit here, and a little bit here. Yeah. These two glides are not only good for mobilizing, but also releasing a little bit of tension around the joint capsule, the medial glide. So I go ahead and bring her up into 90, and like I said, we don't want to take her into anything that's going to be uncomfortable. But what we're going to do is I'm going to go ahead and guide her through the motion so she feels that. And what we're going to be doing is bringing her out into abduction and external rotation. So bring out the external rotation, abduction. And what I'm going to do is I'm going to go ahead and approximate my hand on the greater trochanter. I'm going to mobilize that force medially to put the head of the femur into the acetabulum, while she goes ahead and actively brings it out for me and into external rotation. So we'll go through the motion a few times. You can feel that going into the joint capsule. Any pain?
Yeah.
Do you feel it loosening it? We'll go through about 8 to 10 reps of this, just to kind of loosen it up. And each time her becoming a little bit more active with the motion. Go ahead after we finish it up, and I'll passively move her through and test the infeel and ask her about the experienced pain. So are you feeling any pain here?
Okay.
Okay. You feel a little bit looser?
Mm-hmm.
And that's what we want to be feeling, especially with the medial glide and compressing that into the acetabulum. So the second one is where we use the mobilizing belt. So what we do is we ask the patient to go ahead and place it into the groin area, preferably have them do it themselves so that they're comfortable with it. So Kristen, can you go ahead and bring your leg up and place that down to your groin as comfortable as you can go. Now I'm going to bring this down around the bottom of my buttocks and tighten it up so that we have that stabilized. So as soon as she has it in place, I'm going to go ahead and lean back a little bit. I'm going to grab the inside of the knee again, and I'm going to stabilize the greater trochanter with my right hand. So in this motion, I'm going to go ahead and take her through again. We're going to be doing adduction and internal rotation. Lean back a little bit to get that joint capsule separated. Do you feel the pull?
I do.
Okay. I'm going to get her back, and then I would like you to bring your leg in and in for me, okay? So, I'm going to distract and go ahead and actively bring that in. Okay. And again, we're going to do it for 8 to 10 repetitions, progressively getting more active with the motion and increasing the range that we go. So, lean back, distract, and do it with the physiological motion. Again, this should be releasing a little bit of the tension and restricted motions, and then we will go ahead and take her through. Check. Any decreased pain?